Hello, my name is Pranav, and I'm part of the Health Needs RX Spotlight team. We're an organization with a mission to empower people to make their own healthcare decisions. We create video content and information guides on essential topics, including chronic diseases, mental health, health literacy, and more to help people optimize their health efficiently. Today, I'm joined with Dr. Garshick, who's a board-certified dermatologist and clinical assistant professor at Cornell University. She will talk more about affordable skincare and prevention and management of skin conditions. Thank you so much for joining us today.
Yeah, no, thank you so much for having me. I'm excited to be here and speaking with you.
So, how did you know that you wanted to be a dermatologist?
Yeah, so for me, when I was younger, I actually myself saw a dermatologist. I experienced some acne growing up, and I loved the way that my own doctor was able to connect with me as a person. So, not just my skin condition, but also kind of understanding what the implications of the skin conditions could be. And so, I always had it in the back of my mind, but going into medical school, I wanted to still keep an open mind, and I did. But what I found was that dermatology really created a nice blend of all the different things that I like. So it allowed me to see children and adults. So right now in my current practice, I see multi generations of families. So I see the children, the grandchildren, as well as the grandparents. I love that dermatology is truly a sort of a glimpse into somebody's inside, in the sense that oftentimes we are able to understand a little bit more about what's going on in somebody's body just by looking at their skin. So there's a little bit of detective work. I also love that it combines both sort of the medical side of medicine, where we have prescriptions, we have diagnoses where we're giving sort of medical treatments to, but then we also have the ability to do surgical or procedures that allow us to really kind of get that quick fix if we need it. And then, of course, there is the cosmetic side of things, which is a really nice opportunity to give people the confidence to feel great in their own skin. So for me, I feel very fortunate that I love what I do. I love going to work each day, and I really do love being able to establish these relationships with my patients and really understand what they're going through with their skin conditions.
That's awesome. So, what would you advise a person who wants to start taking better care of their skin now? Like, what first steps would you recommend?
Yeah, so for sure. So basically, I mean, skincare, I always say, does not have to be difficult. So skincare is something that really, when we start at the very basics, that's honestly all you need. So for somebody who's just starting the process, I always say a gentle cleanser and a moisturizer. And the reason is that our skin is designed to protect us. So it's designed to create a barrier from kind of external factors, irritants, but it's also designed to help keep moisture in. So preventing loss of moisture, which can dry the skin out. So by using a gentle cleanser and a moisturizer, you're able to help support and strengthen that skin barrier, which is going to keep the skin feeling healthy, minimizing sensitivity, minimizing redness, dryness, or other kinds of irritation. So first and foremost, gentle cleanser, moisturizer. Of course, every dermatologist will also talk about sunscreen. And so sunscreen really is kind of the essence of what you can do for prevention. So we know that sun certainly does have an impact on the skin. And interestingly, that effect of sun exposure and UV exposure happens even when you're very young. So before you even realize you're taking care of your skin as a child, you're already getting the negative effects of sun damage. So you really do want to, as soon as you start thinking about skincare, really making sure you're diligent about regular use of sunscreens. So that really means committing to daily sunscreen, not just the days that you go to the beach. And it's important to also remember that's for all skin types. So all different races, ethnicities can benefit from sunscreen.
Yeah, thank you so much for talking about that because I feel like sometimes people see like influencer having like millions of different products that they have in their skincare routine. And yeah, I feel like it's important to always have like, the important elements. But I actually had a follow-up question to that as well. So does it kind of like change with weather as well, whether it's like from, summer to winter? Um,
Yeah, absolutely. So, in general, I always say the basics of skincare. So, when we talk about the cleanser, the moisturizer, and sunscreen, those are really sort of the foundation of kind of the skincare routine. And so while those may not change, meaning you'll still want to use a cleanser in the winter and the summer, the type of cleanser. So sometimes we think in the summertime using either a gel-based cleanser or a foaming cleanser can sometimes be a helpful way to get rid of that excess oil that may build up throughout the summertime. While in the winter months, you may find that you benefit from more of like a cream-based cleanser or something that's a little bit more hydrating on the skin. So really helping to give that moisture back. Similarly, when it comes to moisturizing lotions or moisturizing creams, we usually say that a lighter weight lotion may be preferred during the summer months where you don't necessarily want something as heavy. While in the wintertime, people often can sort of feel better if they have something that feels a little bit thicker on the skin, really kind of locking in that moisture.
Yeah, absolutely. I know like where I live, it's like cold like all the time. So it's like, being able to balance between the two different sort of, skincare routines is important. So
Yeah, absolutely.
yeah, so to address like new skincare trends and like the bombardment teen space, like, with influencers, like I said before, promoting skincare lines and brands on social media platforms, how can teens and adults like distinguish between harmful and effective product, and what should be like their point of reference or who they consult?
Yeah, absolutely. So, I mean, I think kind of the sort of uh, presence of skincare on social media definitely is a positive. So, for somebody who's in the dermatology world and who has always had a passion for skin and skincare, it's amazing to have patients coming to me so enthusiastic about what they've seen and these different products. So I will say, kind of, as much as there is certainly a healthy amount of sort of skepticism from sort of what you read on the internet and what you find, I have to say that I've actually been really impressed by sort of the educational content that is being put out there. That being said, I do think it is important to be able to navigate it and always have somebody who you feel like is a trusted resource, because a lot of the different claims that products make don't go through the same sort of regulations that you do in current prescription sector. So a lot of the medication, or rather the products that are available over the counter, don't necessarily have to show scientific basis for the claims that they make. And so what's important there is knowing that what works for one person may not work for everyone. And so particularly with the influencers and different people who are out there, and even in my own practice, I find what works for one patient doesn't necessarily work for someone else. So if you hear that somebody's kind of swears by a certain cream and you feel compelled to use it, even though you may have dry skin or sensitive skin, it may actually make your skin worse. So I think there's definitely key ingredients that certain skin types can benefit from. So for example, somebody who's looking for like an anti-aging routine, we sort of generally think that an antioxidant is something that in the morning can be helpful, so like a vitamin C, whereas in the evenings like a retinoid can be helpful. So even though those are sort of the essential ingredients, of course, many different brands have a vitamin C, many different brands have a retinoid. So I do think that speaking with a dermatologist, somebody who has some familiarity with an individual skin type, can be helpful to guide them in that direction.
Yeah, absolutely. And with skincare lines like promoting like a lot of products, oftentimes like, products can be like really expensive and make like skincare unaffordable, with like certain types of creams and moisturizers. So how can the general public prioritize products and choose the best options for their budget and skincare?
Absolutely. So this is actually something I speak with my patients about regularly, and I think it is so important in skincare to sort of to know where to splurge and where to save. And I do think that there are very clear places where I think it's totally fine to save. And I happen to think that with many of the basics, it is okay. So meaning cleansers, moisturizers. I go up and down the aisles at the local drugstore, and there are so many great options that have great science behind them, that have great ingredients. So whether it's hyaluronic acid or ceramides or moisturizing factors. So a lot of these products that are easy to find and affordable are still quality. So you're not sacrificing that. And even sunscreens, there's lots of great sunscreens that are at an affordable price point. Sunscreens I find to be a little bit more particular in that for somebody who only likes the feel of a sunscreen that is a little bit more expensive, I say stick with the one that you like. And that's where I would say it's kind of on the fence a little bit, where it's worth it if you'll use it. That being said, my cabinet is filled with many skin sunscreens that are affordable, and certainly affordable brands that you can find at the drugstore. Now, when it comes to other active ingredients, sometimes there are places where it is worth splurging. So there's this entity, vitamin C, which is an antioxidant. And historically, even though it is thought to be very effective on the skin, it is also known to be an unstable molecule. And so because it's unstable, it's been thought that only certain formulations are able to kind of utilize it in a way that's safe and effective and won't be irritating to the skin. So traditionally, some of the brands that had these sort of effective vitamin C serums were at a higher price point. I do think even in the past 3 to 5 years, as we've understood this sort of significance of topical antioxidants and this concept of blue light damage that it's happening, I think a lot of other companies are also putting a lot of research into studying and sort of figuring out how to make these vitamin C serums both stable and effective. And so I do think that even at the drugstore, we're now finding this available. So I think when it comes to skincare, there's definitely a place to feel confident and comfortable using things that are available at the drugstore without hesitation. I often find that less is more when it comes to skincare. And I don't necessarily think you need a lot of products. So, really focusing in on the ones that you need, spending your money within that kind of area, and then not worrying about the rest of it.
Yeah, like I know like all over my YouTube channel, like I'd always be like, oh, this celebrity like skincare routine and like 35, 40 steps. And I'm just like, it's always important to pay attention to that. So thank you so much for, allowing our viewers to understand how to prioritize what products to use. So what sort of things should people look out for on their skin, and what things should receive more attention?
Yeah, so I mean, I think that this is a very broad question in the sense that I end up seeing patients with all sorts of changes on their skin. And so I think when it comes to sort of being aware of your skin, I do think it's just important at the very least kind of giving yourself a look over. And that can mean in terms of spots that may be concerning as a result of sun damage. So spots that you may be concerned are new as a result of sun exposure over time, spots that bleed easily, spots that itch, anything that really stands out compared to sort of the rest of the quote unquote normal spots. But honestly, I find that people should look out for whatever it is that that bothers them. I think what's nice about being in dermatology is that I know that my patients are able to see the same thing that I can. So really, I always tell somebody, if you're ever questioning a spot, even if you think it might be a silly question, it's always worth connecting with a dermatologist. Many dermatologists now are also doing virtual visits. So it used to be some parts of the country, it may have been harder to access a dermatologist where there was a very long wait. But now with lots of this virtual visits, I do find that hopefully dermatologists are a bit more accessible as well. But generally speaking, anything that you notice that's changing is always something that you want to see somebody for.
Yeah, and I know you said like contacting your dermatologist is very important, but like should people who are concerned like contact like their family medicine physician first, or should it be like their dermatologist first?
Yeah. So, I mean, I think if somebody has a connection with a primary care doctor or a family medicine doctor, certainly they feel comfortable with the skin and may be able to kind of direct an individual in the right direction. So, really, anybody who you have as kind of that point of contact, you'd always rather sort of get one foot in the door. So, if it means kind of that there would be a potential delay because you don't know a dermatologist or you don't know the best way to access one, certainly go to sort of that first step to tie you into the medical system. Depending on where you are in the country, different primary care doctors and family medicine specialists do feel more comfortable with certain skincare conditions and doing different things. But I do think that as dermatologists, we do feel comfortable seeing all skin entities. So even things related to the hair and nails. So definitely feeling comfortable reaching out to a dermatologist is always good.
Yeah, and should people be doing any routine skin screenings? I know you said, doing like that routine like look over to like prevent diseases like melanoma. And if so, like how often?
Yeah, absolutely. So, in general, we say that you can do a quick self skin check, which usually can be about like 3 minutes once a month when you get out of the shower, giving yourself a quick kind of head to toe. We often say if you do happen to live with somebody, you can even have somebody else help you out to get a look at some of the areas that may be harder to visualize on your own. And generally, the things that I break it down to for people to look out for, particularly for like melanoma, are what are called the ABCDE. So the A is asymmetry. So if you cut a spot down the middle, it's going to look different on both sides. B refers to the border being irregular. The C refers to either the color changing or multiple colors in one spot. D is the diameter being greater than 6 millimeters, which is basically like a pencil eraser. And then E is really anything that's evolving. So that kind of gives you sort of this understanding that really anything that changes is something that we would care about. So that's a way on your own to really pay attention. There's also this concept of what's called the ugly duckling sign, which essentially refers to the fact that some people have a certain characteristic type of mole or spot. And what we want to look out for is the one that stands out compared to that. So really looking for something that stands out because it's either darker or just different than everything else on your skin is going to also be something important.
Yeah, that makes a lot more sense. Yeah, I know like I've seen like from learning in classrooms like the ABCDs and feel like it's a really easy acronym to learn. But thank you also for talking about like the ugly duckling thing as well. So
Yeah.
I know acne can be a really annoying problem for teens and like young adults and perhaps even like, persist earlier beyond those years. So what should people do to like control acne, like, products and even food that I've heard? Um, so what's sort of like the process that people should go through to take care of that?
Absolutely. So acne is definitely complicated, and honestly I think it's more complicated than most people give credit to, just because it is different and everybody experiences acne in a different way, and as a result the treatment that works well for one person may not be the best treatment for someone else. There are people who have acne who have dry skin, there are people who have acne who have oily skin. So really understanding kind of your skin type and the type of breakouts you're experiencing is really important when approaching the treatment of acne. That being said, there are certain key ingredients that are available over the counter, and accessible for people who are sort of just starting to deal with some of those early breakouts. So for people who experience some of the more like the clogged pore type of breakouts or whiteheads and blackheads, we generally think of things like salicylic acid as being a helpful ingredient, which helps to exfoliate the skin, but also gets deep into the pores to unclog them, as well as retinoids. There is a retinoid called Differin, which actually used to be a prescription, but is now available actually over the counter. So certainly an easy place to start for somebody who's noticing some of those smaller breakouts developing. Another ingredient that we tend to like quite a bit for acne is benzoyl peroxide. So benzoyl peroxide is another ingredient that can be found over the counter. Always a tip with benzoyl peroxide is it can bleach towels and sheets. So just make sure if you are using it, you make sure it dries completely or you rinse it off completely if it's designed to be rinsed off, such as in a wash. And the benzoyl peroxide I find especially helpful for the more red inflamed types of breakouts, as it can help to reduce bacteria as well as potentially inflammation as well. So that kind of sort of includes some of the best things to access from an over-the-counter perspective. I also find actually it's not just what you're using to treat acne that's important when starting kind of an acne regimen, but it's also what else you're using on your skin. So really making sure that the other products, whether it's makeup, cleansers, moisturizers, are what we call non-comedogenic or oil-free. So you don't want your other skincare products to actually be causing breakouts while you're treating breakouts. So generally speaking, again, going back to the foundation, gentle moisturizer, gentle cleanser, but you do want to make sure that they're what's called non-comedogenic. So generally speaking, when somebody is dealing with acne, again, there is the option to speak with a dermatologist to help navigate. And that can be helpful, certainly if the over-the-counter products are not sufficient, or if they are, but somebody's maybe developing either irritation or not really sure exactly sort of which direction to go with those products. At a prescription level, we certainly have slightly stronger retinoids available. We also have other topicals, including topical antibiotics, as well as oral medications. And I think for people dealing with acne, sometimes oral medications can be helpful. So it's important to just remember that as well.
Yeah, and I know this one's a big one with like acne, with like a lot of people are talking about, getting acne around that region. Could you clarify a little bit more like what that means and how people can prevent it?
Yeah, absolutely. So in the beginning of the pandemic, we started to see this a lot, especially in healthcare workers and people who are wearing their masks sort of for extended hours of the day. And it evolved as this concept of what is known as acne mechanica. And it's a type of acne that describes basically acne that develops as a result of occlusion. So it used to be thought to be in maybe like athletes who wore helmets. And if something was creating some occlusive environment, it would cause the pores to become clogged, and as a result, breakouts to ensue. So at this point, it's now evolved as now it's not just healthcare workers certainly wearing masks, it's everyone. And people are finding that they're either people who never experienced breakouts before now developing breakouts, people who have had acne before who are finding it worsening. And then there's also now another subset of people who are developing more, not just breakouts, but actually irritation of the skin underneath the mask, which may be related to dryness or sensitivity to the fabrics that are included in the mask itself. I'm also incidentally seeing a lot of patients experiencing something called perioral dermatitis, which is almost like a combination of acne, another type of breakouts called rosacea, and eczema, sort of all rolled into one. So a lot of the time, these individuals may just experience like red, blotchy skin with some breakouts, flaking, and really not be sure exactly what's going on. And so that's certainly something that we've been seeing and doing what we can to help. So obviously, at this point, masks are here to stay. So for these individuals, as far as treating it, we're kind of doing our best to certainly treat the breakouts without necessarily causing extra dryness to the skin. And so for some, it means starting slowly. So even though a lot of the ingredients like benzoyl peroxide, salicylic acid, and retinoids may still be effective for these individuals, sometimes starting them all at once can actually be too harsh on the skin. When you wear a mask, you actually create this environment where there's actually moisture that's kind of getting trapped, but it actually incidentally can actually dry the skin out a little bit as well. So you don't want to do anything to irritate it. I do think some people who are experiencing the breakouts in this area, sometimes those are also hormonal or stress induced, which of course people are experiencing all sorts of stress right now as well. So those sometimes we are able to address, but it may be more with pills if needed.
Yeah, that makes a lot more sense. I know like a lot of people are like talking about like irritation around these regions. So yeah, thank you so much for talking about that.
Yeah.
So now to talk a little bit more about like skin cancer. So how can people identify skin cancer early, including like squamous and basal cell carcinoma and melanoma early?
Yeah. So, I mean, again, sort of kind of going back to this theme in dermatology, where what's great is that people can see it. So people can look in the mirror at home and see that there's something on their skin. And honestly, a lot of the sort of ways that even as a dermatologist, we end up finding skin cancers are actually from a patient who comes in and is like, I have this spot, it's something new. Do you mind checking it out? And sure enough, it is something that's worthy of concern. So I always say that a patient is most definitely their first line of defense. And so definitely just paying attention. But of course, how do you know how do you know what's what? And so for basal cell and squamous cells, which are what are considered non-melanoma skin cancers, we tend to think of them as pink spots. So I always say it's like a pink spot that doesn't go away, a pink spot that comes back even though it does go away. So it comes back in the same spot even if it does go away in the previously. spots that are flaky, spots that bleed easily, spots that just sort of catch your attention. And then for some individuals, it even is just kind of something that you can feel more than you can see. So for some people, they may experience something called an actinic keratosis, which is thought to be maybe like a pre-skin cancer. But it's basically if you touch the skin, it feels almost like sandpaper, even though you don't necessarily see something. So when it comes to the basal cell and squamous cells, those are sort of the key things to be on the lookout for. In general, there are obviously other situations where they can look like different things. So I always say anything that feels new or different is worth checking out. For melanomas, again, it sort of tends to be more of these dark spots. Another area that's important to know and pay attention to changes are on the nails and the bottom of the feet and in between the toes. So those are all kind of hidden areas where people don't necessarily think about, but definitely you can still get spots there and you want to be familiar with them. So as far as catching things early, generally I say if you're paying attention to your skin and you notice something new, that's basically as early as you're going to get it. And so the nice thing about skin cancers is that when they are detected early, generally speaking, the treatment is limited to just removing it. And so the earlier you find something, certainly the smaller the spot that needs to be removed, and potentially the less that needs to be done thereafter.
Yeah, and like going into like risk factors, what are some risk factors involved in like these cancers?
Yeah, for sure. So, generally speaking, many times we think of some of the greatest risk factors being related to sun exposure. So, that's both UV artificial as well as natural UV exposure. And this can be both cumulative exposure over time as well as just individual burns. So, there are certainly risks associated with even just getting one or two childhood burns, which is why it's so important for people to also remember to use sunscreen before it's too late. So really thinking about it as adolescents. Generally speaking, those who have fair skin, light eyes, blonde or red hair also are at a greater risk of certain types of skin cancers, particularly the non-melanoma skin cancers we tend to think about. Family history is very important. So I always want my patients to sort of have a sense of if anyone in the family does have a history of skin cancer. Of course, having a prior skin cancer does put you at an increased risk of another skin cancer. So it's important to know that just because you make one doesn't mean you're done and that you may continue to develop them. So you do want to still be mindful of that. And then for some skin cancers, certain medications that suppress the immune system can sometimes slightly increase that risk. And so these are all things that, certainly speaking with your primary care doctor or a family medicine doctor, can be helpful to understand what your risk factors are.
Yeah, and I know you kind of alluded to this earlier, but when is it time to call the doctor? Like, you know, I know you were mentioning like with the pink spot that won't go away and like some like if something feels different, but what are some other times when people should definitely call the doctor?
Yeah. So if a spot is causing pain, is definitely a good time to call the doctor. If it's bleeding, and so again, sort of some of the original things as far as like it not going away. I tend to be of the mindset that while it's great that patients and individuals at home have the ability to see their own skin, I don't always expect them to know what's right versus wrong. And so my threshold tends to be pretty low as far as if you just have a question, it's always worth checking in because you never know. Sometimes we are surprised, meaning there's a spot that may look like it's nothing, and then all of a sudden they come into the office and we do a biopsy and it turns out to be something. So again, with skin, just because it is something that we would always rather catch earlier rather than later, I say if you are in doubt, call somebody and just kind of have the conversation. We'd always rather say it's nothing to worry about than have you sitting at home and worrying about it.
Yeah, absolutely. And I know you were kind of talking about like the treatment plan earlier, but what's sort of like the general treatment plan across like the various skin cancers and what can one expect across the course of treatment?
Yeah. So, I mean, the nice thing about skin cancer of any cancers, if you can say that there's a nice thing about cancers in general, is that oftentimes it's just a matter of cutting it out. And so for some skin cancers, which can develop on what we consider to be more cosmetically sensitive areas, so certainly the face, which gets a lot of sun exposure, there is a specialized type of skin cancer surgery called Mohs surgery, which is a type of surgery that's designed to help preserve the amount of healthy skin. So, meaning we ensure that when we remove the skin cancer, we're removing all of the problematic tumor cells without removing too many of the healthy skin cells. So, what that does is it ensures that the problem is removed, but preserves as much healthy skin as possible, leaving the individual with the smallest possible scar. But when it comes to melanoma and some advanced stage, even squamous cell skin cancers, there are potentially the risk of not just needing to cut it out, but also needing additional treatment, whether it may be in the form of either an oral medication, radiation, something called immunotherapy, or even chemotherapy. But by and large, majority of skin cancers can be treated in an office setting under local anesthesia, again, just by cutting it out with a margin of healthy skin.
Yeah, so definitely catching it early is definitely very important. So, how do you make your patients stay motivated to continue taking care of their skin and encouraging healthy routines?
Yeah, and I think that this can be hard because I do think that it takes patience, and sometimes we want things to happen overnight and they don't, and so it's tough to kind of hang in there. Especially some medications sometimes can cause a slight worsening before it gets better. Some medications, because they don't work right away, it's hard to know if it is working and what should be done. But I do try to kind of convey that to people in general, just because I think with a lot of the things that we apply to the skin, if you understand and kind of take it in that it takes time for those skin cells to adapt to it, and you understand that it is part of the process and that the light at the end of the tunnel is there. It just sometimes can take even 6 to 8 weeks, sometimes even 3 months, and just to really try to power through that. Once you get there, you'll be in a good place. And that place is generally one that's even better because you're not just treating the problem that you have, you're really preventing it from coming. So, for example, with acne, a lot of the medications are designed to really prevent new breakouts. And while we're always tempted to sort of treat the spot that we have and just put a spot treatment on and say, okay, now it's gone, by preventing new breakouts, ultimately you're really going to get the best outcome because you're really taking care of it where it's the cause is actually. So, and I try to explain to patients and to certainly anybody who wants to reach out to me, that I'm part of the process with them. So I never want them to feel like they have to stop the medication. So I always tell my patients, if you're feeling like you're at a point where you don't want to use the medication anymore, you want to stop, use that time to reach out to me. And even if it means we stop it, at least we come up with a plan of how to continue. So I think just knowing that it takes time, it takes patience, but once you're there, you'll be happy, I think is sort of the main way to try to motivate people. But I also think it's important to not get too swayed by what other people are doing. So very often somebody will get into a skincare routine and feel comfortable in it. And then all of a sudden they'll love the way their skin is, but their friend is using something different. So then they want to quickly switch. And so I think it's important to, once you find a routine that works for your skin, don't feel like you have to keep switching around. Really just try to stay the course. And then if new skin problems arise, then we would address it as needed.
Yeah, I know when I was trying to get accustomed to my new skincare routine that I started over quarantine, like I definitely did not have the best results at the beginning, but yeah, it definitely took time and a lot of effort to, actually like get out of bed and like actually put it on. And I know it's definitely important to stick to a routine. So for our last question, is there anything else that you would like to share with our audience?
Yeah, I mean, so even just kind of piggybacking on what we were just talking about. So I think another thing with skincare and skin products and trying new products, as you mentioned, quarantine. And it's true. I feel like in the beginning of quarantine, a lot of individuals were sort of trying these new routines. And it was true at the beginning when we didn't know how long it was going to be. We sort of were joking that whatever we're doing now, when you come out of quarantine, your skin will be great. But certainly now that enough time has passed. But I think another way of kind of maintaining motivation is knowing that even though we want you to be consistent, if you are experiencing dryness or sensitivity, it's okay to take a break. So it's okay to stop for a day or two and then pick up again. So it's always important to remember that, like, even if you stop for a day or two, it's not going to set you back that far. So you just want to sort of be kind to your skin, understand what your skin is going through, and kind of respond to that. And so if it feels like your skin's a little bit drier because the weather is changing or the seasons are changing or just based on where you live, you want to sort of be in sort of awareness of that. But other than that, I would say, just as far as things to add, just that I think the skin is your greatest investment, and so it's one of those things that what you do to your skin when you're young truly does have an impact as you get older. So when it comes to whether it's anti-aging or skin cancer or just general kind of moisture retention of your skin, naturally things happen over time. So what you start doing as in your 20s and your 30s is going to ultimately give you the greatest impact. So we talk all about sort of this concept of affordable skincare and things like that. And it really is worth it, especially if you're thinking of kind of that long-term plan, and what you're ultimately getting out of it. And if it is healthy skin for a long time, then you've won.
Yeah, so thank you so much for joining this episode on detailing skincare. It was an honor to have you. And thank you so much for educating our audience on this. I know a lot of people are like intrigued about skincare, and thank you so much for clarifying any misconceptions and, explaining to our audience ways to better take care of their skin.
Absolutely. Yeah. Thank you so much for having me.